I'm Suzanne. I'm your pharmacist.
Howdy, I'm Billy Bob.
Hey, Billy Bob.
I'm your patient.
Good to see you.
That's good, yeah.
So, it seems like your doctor has given you a prescription for insulin.
Yeah.
Did he tell you what that was for?
He told me it's for my diabetes.
Yes, you have diabetes, and it's the type 1 type of diabetes.
Type 1?
Do you know what that means?
No, I have no idea.
So basically, when you have type 1 diabetes, your body is no longer making insulin. And
What's that insulin deal do?
Insulin is what is kind of considered the key to be able to take your glucose from your food and from your body to be able to utilize it for energy in your body. And all your cells need glucose in order to function.
Alright, so it's like a monster drink then, right?
I wouldn't really consider it like a monster drink.
Alright then.
But something that your body makes to help you utilize.
But I know I gotta do it.
Yes, so that means you
My
definitely.
grandma used insulin.
Oh, okay, great. So then you guys can talk about your insulin. Yes.
Yeah.
So basically, the thing is though, since your body isn't producing it, it's very important that you administer the insulin as directed. Okay, so we'll go through all of that.
So I'm going to learn how to do it now.
Exactly.
Oh, joy.
Exactly.
Right.
Okay, so how did your doctor tell you to take the insulin?
He told me to come down here and you show me.
Okay, perfect. That's why we're here.
So I'm busy, go see the pharmacist.
Okay, yes, doctors are very
I didn't know
busy.
you guys did this stuff.
Oh,
I thought you just counted pills.
No.
Alright
We do
cool.
a whole bunch of things.
Alright.
Okay, so
you gotta go to school for that?
Yes, you do.
You do? Okay.
You do.
Alright then.
You have to go for sometimes 6 years.
That's a long time.
So you
That's
get
more
to-
school than I've had.
Really?
Really?
Yeah.
Okay.
Well, you learn a lot more than scooping pills.
Yeah, well, right.
Yeah.
Okay.
So let me tell you. So first, basically what I want to tell you is that you're going to get 2 different types of insulin. Okay? So the thing is that when you eat, you're going to get a lot of glucose because glucose is coming from...
That's sugar, right?
That's sugar,
All right,
exactly.
okay.
So it's coming from your meal.
Okay.
And so you're going to be getting a really big surge of glucose or sugar after you've eaten.
Now what if I don't eat no sugar? Say you just have like a hamburger and Diet Coke. Do I
Well,
still need to take my insulin?
You know what? Glucose comes from a lot of different sources of
No
food.
way. Really?
Yes.
All right then.
So you are going to have to take it whenever you eat a meal.
Okay.
Okay?
Okay.
So that will call your mealtime insulin. Okay?
Okay then.
Then there is something called your long-acting insulin.
All right then.
And so you need the long-acting insulin because your body is needing glucose all throughout the day.
All right then.
So we have to give your long-acting insulin, which is you give without regards to meals.
All right then.
So every night before bedtime, you're going to take your long-acting insulin.
All right then.
And then you take your mealtime insulin with meals.
So I got to do this a lot then.
You do.
All right.
Yes. So what would happen if you were to skip a meal? What would you do with your mealtime insulin?
I don't know.
Okay, so if you are not going to eat a meal, you will not be taking your mealtime insulin.
Okay.
Okay, so
That makes sense.
long-acting you take every night.
Okay.
Doesn't matter if you're eating.
So don't take my food insulin with no food.
Exactly.
All right then.
Exactly. That's a good way to remember it.
All right then.
Okay.
But I still got to use my long insulin, right?
Yes.
Okay.
Still have to use
I
your
got you.
long-acting insulin. Okay.
All right.
So, this is the insulin vial. So
Okay.
when you pick it up from the pharmacy, you'll notice that it came from the refrigerator.
Okay.
Okay? But then when you take it home and you start using it, you don't have to keep it in the refrigerator.
Oh, I don't?
You can keep it...
My granny carries it all around ice packs and things like that. Even when she goes to the grocery store.
Yeah, you don't,
You don't
need
have to do that?
You don't need to.
That must be that newfangled stuff then, huh?
Yes, it's
All right.
formulated so that you don't have to do that.
Well, that's pretty good because I don't care for the ice packs.
Right, exactly.
All right.
However, you don't want to keep it out in the sun.
Oh, okay.
Okay, so you have to be still careful. You
I
want
can't
to
keep it in my truck?
No, do not keep it in
Okay.
your car because
Okay.
then that will ruin it.
Okay.
So make sure it's really room temperature, stable temperature for the
All right,
insulin
yeah.
storage. Okay?
Put it over by the air conditioner?
No, I wouldn't do that
Okay.
either. Just maybe you can find maybe a cupboard in your kitchen.
All right.
Wherever you'll remember it's there.
Because it's food
and
insulin, you keep it in the kitchen.
Exactly.
I like
there
you.
you go. There
All right.
you go.
All right.
Okay. The other thing, before you give your insulin injection, you just want to give a little look to see that there's no clumps in it. So you don't want to inject any clumps, right?
And
then if there are clumps, then you're going to have to get another vial because that means maybe the insulin went bad. So you just want to give it a little check before you do it.
All right, then.
Okay? So we'll start with the injection, and what I'm going to do is I'll show it to you, and then after you can show me how you'll do it.
All right, then.
Okay? So this is a new vial, so we're going to open it, and whenever we do that, we're going to wipe the top of it.
That's to clean it?
Yes, this is to clean it, and you're just going to do one little swipe.
All right, then.
Okay? Then, your doctor prescribed 10 units of insulin for the nighttime dose.
10.
Okay? So what you're going to do, so here you can see all the little marks, all the different numbers. So what you're going to do is fill it with 10, up to 10, with just air. Nothing but air. Okay?
Well, how's that going to help my diabetes if it's just air?
That's a good question. So what we're going to do is take this air and put it in here.
Put the air in there.
You put it in, and then you press the plunger like that. And now we're going to fill it with insulin. This is just saline.
Oh, right.
This isn't actually insulin.
For practice, right?
For practice.
All right.
And then you just want to make sure there's no bubbles. So you just kind of flick it up.
Just like the TV show.
Exactly.
All right, then.
Which TV show?
I don't remember something, Doctor something or other.
Okay. Yes. Doctors do.
Yeah, my granny likes that show.
Yeah.
Watch all the time.
Okay.
All
So
right.
you see it's at 10. And now you go like this. So now you have it all
where's the 10?
ready.
How do I know it's at 10?
Right here.
Right there.
Yeah.
Okay. Right on the line.
Right.
All right.
Okay. So now when you're capping it, you never want to put it on like this. You want to make sure that you go like this to recap it.
Okay.
So that now it's ready.
My grandma just puts it in her teeth and just
puts
back like
that's
that.
Not something
no good?
you want to do.
All right.
No.
I'll have to tell her don't do that.
That's true. You can tell. Now you can teach her all the things that you learned.
Sounds good.
Now the next thing, I'm going to stand up here, is now you need to prepare your injection site, which the best places are going to be in your abdomen.
On my belly?
Yep.
Right here?
You can also give it here, in your outer arms, in your thighs, and in your buttocks. Okay? However, this is going to be the best place.
Okay.
So we'll have you
right
do
here
it
is good,
here.
right?
Exactly.
Okay.
Right. So we're going to just clean the area real quick. So we'll just scrub the
area.
Skin.
Okay.
Like that.
Okay.
And now you want to make sure to let it dry.
All right.
Because if you do it now, it'll sting a little.
Okay.
So we let it dry. And now we're ready to take the cap off.
Okay.
And then we're going to put it in the skin here. So you just go
right there.
like this.
Okay.
Put it in.
That hurt?
Nope.
Not at all, huh?
Not at all. And then you want to hold it for just a few seconds so you can make sure it absorbs.
Okay.
And then take it out.
All right.
And now this is the important part because it went into your body. You never want to recap it.
Okay then.
Okay? So what you're going to do, and we'll give one of these to you, is you'll put it in one of these sharps containers.
My grandma got one of them.
Exactly, which keeps really sharp things in it here. And so they're biohazard waste.
Okay, I can't put my buddy Billy in there. He's not so sharp.
No.
All right. Thank you.
The other thing is there's one of these, which if you're on the go and you don't have one of these, you can actually clip the needle off. And this will hold a bunch of the needle tips. Exactly.
All right.
So there's in here, you can kind of hear there's a bunch of needle tips in here.
All right, cool.
So that way when you're out and about, you can clip the needle off and then you don't have to worry about it.
Okay.
But we'll just throw this in the sharps container.
Okay then.
And then you want to make sure not to put any other trash in here because you're going to have to take this into a place that's registered to collect these. We'll give you all that information.
All right then. I have no idea where.
Yeah, don't worry. We'll give you all that.
It's all new to me, man. All new to me.
Yeah, I know. So, and it's kind of a lot, but.
Yeah, my grandma just throws in the trash when she's.
No, you really shouldn't do that.
Oh, I don't.
Because it's considered biohazard waste, so we'll go through all the different places.
I got a lot of things to teach her.
I know.
All right.
This will be good though. It'll be a good learning experience. Okay, so would you like to show me now how to do it?
Well, yeah, I could do the deal.
Okay.
Okay, here. So I gotta take this off. And this part right here. You said 10, right?
10. Yes.
10, okay. Is it the bottom part right
Oh,
there?
that's a great question.
Or what
it's
part?
actually the top part right there.
Oh, it's that part?
Yes.
Oh, okay then.
The
It's
top part.
The
That's
top
a
part
great
of the
question.
plunger. Okay. And then, oh, I gotta swab it.
Yep.
I put a thing on there. Alright then. One like that, right?
Okay.
Okay.
Perfect.
And then this goes in there like this.
Yep. Okay.
Put
Press
my,
the plunger down.
and I turn it over.
Yep.
And then I
All the way to 10.
right 10. Okay.
Mm-hmm.
I don't see any bubbles in there, so that looks pretty good.
Yeah, I think you're good.
What do you think? Is that alright?
I think that's good.
Okay.
Okay.
Alright.
Yes.
Now do I just pull it out now?
So now flip it back
I'll
over.
flip it over.
Yep.
And then take it out.
Right. Because we
Alright.
want to be sure that the needle doesn't bend
Okay.
out.
And then I put that in there like that, right?
Exactly.
And then okay.
Okay.
Alright then.
All right.
So do I have to stand up or can I?
You can
this
do
sitting
whatever
down?
you want. As
Alright, so
long
I'm
as
going
you're-
on my belly right
Okay.
here. Okay.
Here's the alcohol swab.
Okay. So I'm gonna put it in my belly right there.
Exactly.
Okay, so I gotta clean it up.
Oh wait. So for
That's
this,
cold.
you'll want to use a fresh one.
Oh, a fresh one?
Yes.
Okay, alright. So that's cold.
Yeah. It's a cool sensation.
Yeah, okay.
So wait for it to dry.
How do I know when to dry?
You will be able, when you wave it like that,
Uh-huh.
you see how it feels cold?
Yeah,
It won't feel
Okay.
cold anymore.
okay. Now, okay, so I gotta do this.
Mm-hmm.
Take the cap off, right?
Exactly.
Alright. I don't like needles.
I know. It's okay. You'll see
Alright,
them.
so now I just stick it in, right?
Yep.
Do I gotta go hard?
No.
Or can I just push it in?
You can just push it in.
Alright, so just
It'll
go
be
like,
really
like that.
easy. Yeah.
And then like, oh, that's pretty easy.
Yeah. It's not so bad, right?
So now I push on that.
Press the plunger down.
Alright then. Then you said I wait a second?
Yep.
Okay.
A few
And
seconds.
then I pull it out?
Pull it out.
Do I let go first?
You can let it go.
Alright, and then pull
it
out.
out.
Okay, there we go. Hey, that's
There
easy.
you go. Now what do you do?
Put it in there.
Yes. Always put it in the sharps
Alright.
container. Okay.
It's not bleeding or nothing either.
No.
Okay.
So how was that?
Well, it wasn't fun, but it's
Right.
pretty easy.
Okay.
Okay.
Doesn't hurt as bad as you would think, right?
No, not so bad.
Okay. Great. So any questions on that so far?
So, now when do I do this?
Okay.
Before I eat.
Yes.
10,
So
and I use 10.
so what your doctor gave you is a prescription for you're going to be taking 10 units at night
Okay.
before you go to bed. Okay?
Okay.
So you take that without regards to
Okay.
meal.
But that's the long acting.
Long acting, exactly. It's going to
What's-
work all day
What's the
long.
name of that one?
That one's called Glargine or Lantus.
The Lantus.
Yes.
What color
I'll
is the
write
bottle?
that down for you.
What color is the bottle?
The bottle is going to be white with a little purple.
Purple. That's the white and purple.
Yeah.
Okay.
We can label it for you.
Okay, good.
That's
good.
what we'll do.
Okay.
Then you're going to be taking rapid acting
Okay.
insulin, which is also your mealtime or your
Okay.
food insulin, like you
Okay.
said. Okay?
All right.
So that you're going to take 15 minutes before you eat.
Okay then.
So that's really important, the timing of when you take it
Okay.
and when you eat.
Okay then.
And then what happens if you don't eat?
I don't use it.
Exactly.
All right.
Okay, good. So those are the two different insulins. And so for your mealtime, you're also going to be taking 10 units.
All right.
But it might fluctuate based on different things that you eat.
Okay.
And so your dietitian is going to go over that with you, and you're going to
Alright.
learn all about all the
Supposed to
sorts of
see them next week sometime.
Exactly. So
Okay.
you can tell them what you learned here
Okay.
and tell them about what insulin you're
Alright.
on, and they'll
Okay.
take care of you.
Now, what about that sugar checker deal?
Okay,
What-
we will get into that.
Okay.
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 So, what did your doctor tell you to expect from the insulin?
He said that I'll probably start gaining some weight back because I've lost a lot of weight since it
Okay.
started up,
Yes.
and it says sometimes I might feel dizzy, and I need to make sure I check my sugar with that gizmo.
Okay. Yes, that's true.
Mm-hmm.
So this is your blood glucose meter.
All right.
Okay. So I believe your doctor already went over how to use this with you.
Kind of,
Okay.
sort of, yeah.
So basically, what you'll be doing is you're taking a strip.
Mm-hmm.
This is called a test strip,
Okay.
and then you're going to be inserting it in
Mhm.
here. And that will just turn the machine on.
All right then.
And then it has a little drop of blood, which means it's ready for you to test.
All right then.
Okay? So, as far as testing goes, this is also something that we'll have to have another consultation about, because testing is going to be really important.
All right then.
But you're going to want to test all throughout the day. You want to test before meals, after meals, and then at bedtime.
Okay.
Okay, so it's going to be at first definitely a lot of testing.
It makes your fingers hurt.
It might make your fingers hurt, but again, those needles are really, really small.
All right.
And so they're in here.
Okay.
So when you test right before you take your insulin shot, you'll be confident that you can take your insulin shot, because you don't want to give your insulin if your blood sugar is too low.
Right, because the insulin makes it even lower.
Exactly.
And I don't want to go too low.
Exactly.
Because then I'll get all nervous and crazy.
Right. So yes. So
I see my grandma go.
Okay. Yeah.
Wackadoodle when her sugar gets too low.
That's true.
Okay.
So let's go over that. So what do you think are some of the signs or symptoms of having blood sugar that's too low?
Well, like I know my granny, she gets real crabby. And then she might get a little dizzy, and you don't know what she's talking about sometimes.
Right.
She's just talking to the wall, and things
Exactly.
we go, oh, we got to get her some sugar.
Right. Well, good. So you know most of the signs.
Yeah.
So you might also feel a little shaky, or you might start sweating.
Okay. Yeah.
So whenever you feel that, it's really important to check your sugar, and then see where you're at, and then be sure to have a source of sugar.
Okay.
Okay.
But they told me not to eat a lot of sugar.
Right, so you want to eat about 15 grams. So what is 15
how much is
grams?
that? I have no idea.
Let me tell you.
What's a gram?
So a gram is a measurement of sugar.
Oh,
okay. But I'll tell you, you can see on all
your... Is it like a cracker?
It's a few crackers.
Okay.
It's about 5 crackers.
All right then.
But you can take about 5 to 7 lifesavers.
Okay.
That would be a good amount.
Okay.
The best thing is to get glucose tabs.
All right.
Which you can buy at the store.
I've seen them.
I'll write those down, because then you know exactly how many. Yes.
Okay.
We'll go get those after this.
All right then.
But they have 4 grams of glucose in them.
Okay.
And you want to get 15.
Okay.
Okay. So you're going to take about 4 of them.
Okay.
Okay.
Okay. That's 16.
Yes. So it's a little over, but it's okay.
All right then.
So you'll want to do that, and then after 15 minutes, check your blood glucose.
Okay.
If you're not going to be eating for a while, make sure to have another snack to make sure that you're there. And something with protein will be good to make your sugar stable.
Like what?
So protein is in meats,
it's
in beans or nuts.
Okay.
So
you have like a snack.
Exactly.
Okay.
So.
And then make like a steak or something.
Yes, but make sure that it doesn't have to be very big. You can make it a small snack.
Okay.
But you want to make sure to keep checking it to make sure that you don't get those symptoms and that your sugar gets normal again.
All right then.
Okay? Okay, so that's low blood sugar. And then when your blood sugar is high, it's a little hard to tell.
All right then.
So oftentimes you can't really tell unless you check your blood glucose.
All right then.
And then with high blood glucose, that's when we have to adjust your insulin dose.
Okay.
Okay? So the best thing to do, which I'll give you as well, is to take a log of all of the different blood glucoses that you get throughout the day.
All right then.
Because that's going to give us a good idea of how we can adjust your insulin so that you are well controlled with your blood glucose.
All right then.
Okay? Okay, then let's see. So let's go over the side effects again.
All right then.
So what will the side effects be if your blood glucose is too low?
Jittery, kind of crabby.
Okay.
Might be dizzy, sweaty, right? Okay.
Okay. And what will you do if your blood glucose is too low?
I want to eat some sugar and test my blood.
Okay. Good. And how much sugar?
You said something like 15 deals or whatever, like
15 grams.
Okay, 15 grams. And so that's like 4 of them glucose tablets or a whole bunch of lifesavers.
Right.
Or some soda crackers or something like that.
Right.
Okay.
So next week, your dietitian will go over all of this with you to make sure you know exactly what's in your food, because that'll be really important as you start taking insulin.
All right then.
Okay? Now the other thing is, since you'll be injecting this, there might be some reactions on by your injection sites, but the way to avoid that is to make sure that you rotate. So I have this little tool for you to remind you of how you should be rotating your sites. So this is something you can see goes on his abdomen. And you can it's just a way to keep track of where you're going, because you're going to be giving several injections a day.
All right, yeah.
So
I got to spin them around?
No, not necessarily. This is just a way to go like this, and then you say, okay,
you got
this here,
move it around.
Exactly.
Okay, different spots.
Exactly.
I got you, okay.
Because even though there's other places you can inject, you want to stay in one area to make sure the absorption of the insulin.
Okay, but don't use the exact same spot.
But don't use the same spot.
All right,
exactly. Okay? Okay, so I know we went over a lot of information, but it seems like you know how to take how to actually administer it. You know what to look out for your low blood glucose. Is there any other questions that you have?
No, my brain's pretty full right now.
Okay.
Sounds pretty good, but now I need to start doing this like today, right?
Today, yes.
Okay. All right.
So this is really important. So you're gonna have to start doing it with your meals and at night.
All right.
And monitoring your blood glucose is gonna be really, really important.
All right. So I got to use that thing and then do my insulin. Okay.
Exactly.
And then I can call you if I got questions, right?
Yes.
Okay.
Okay.
All right then.
So what else can I answer for you today? Anything?
I think I'm pretty good. I think I got this. I got this down. I have to take some practice, but.
Okay. So I am going to give you this sheet to remind you to rotate your sites.
Do I have to mark it off when I give a shot?
You don't have to mark it off. You can if it helps you remember, but this is just for your help. And you don't need to use this, but it's just a tool to use.
Okay.
I'm going to give you a little brochure on the signs and symptoms of low blood glucose and what to do. So if you forget, you can just refer to that.
Okay.
And I'll give you another sheet about how to actually administer the insulin.
All right then.
So you'll have all of this to take home with you, and then you can always call us whenever you need.
Okie dokie.
Okay?
All right.
All right.
Okay, thank you very much.
Thank you. It's
Much
nice meeting you.
All right then.